Gastroenteritis, or gastro, can spread easily in residential aged care facilities, so it's important to know about gastro and how to prevent it from spreading. When an elderly person contracts gastro, they are more likely to become seriously ill and may even die. This video aims to help people working in aged care facilities to prepare for managing gastro outbreaks. This video will cover 1. What is gastro? 2. How you know if someone is sick with gastro? 3. How does gastro spread in aged care facilities? 4. Ways to stop the spread of gastro, including importance of hand hygiene and infection control procedures. 5. How you know you have an outbreak and what to do if you suspect one. 6. Specimen collection. 7. Cohorting of residents and staff. 8. What if a resident needs to go to hospital? 9. What to do if you become unwell. 10. How to know when an outbreak is over. 1. What is gastro? Gastro describes a group of illnesses that cause diarrhea and vomiting. These illnesses are spread by a variety of germs, including viruses and bacteria. These germs can be very infectious because it only takes a very small number of the germs to infect other people. These germs can also live on surfaces for many days and weeks if they are not removed properly. The aged care environment places residents, staff, volunteers and visitors near each other, and this means that the germs may spread quickly through the facility and cause illness in many people if not stopped quickly. The elderly are at greater risk of illness because of their age and lowered immune systems. 2. How do you know if someone is sick with gastro? A sick person may have any or all of the following: nausea and vomiting, diarrhea, stomach cramps, sore muscles, tiredness, fever and headaches. Importantly, a person may also have stools different to their normal pattern. Tell your manager if you think a resident, visitor or workmate has the symptoms of gastro. 3. How do gastro germs spread? Gastro is spread via the fecal-oral route. This means that germs in stools pass from one person to the mouth of another person. Gastro-causing germs can spread easily from people's hands, equipment, surfaces or in food. Also, tiny droplets of vomit can sit in the air for some time. This also has the potential to cause illness. People with gastro can spread the germs while they are sick and for up to 48 hours after their symptoms have stopped. Norovirus, or noro, is a type of viral germ responsible for most of the gastro outbreaks that happen in aged care facilities. Just a very small number of these germs on a person's food or hands when swallowed is enough to make them sick. Not washing your hands after attending to a sick resident can spread the germ. Gastro germs are spread through sick residents, sick staff, sick visitors, poor hand hygiene, contaminated surfaces and food. So, not following appropriate infection control precautions can spread the germs and make you and others sick. 4. Ways to stop the spread of gastro within your aged care facility. To stop the spread of germs, it's important to practice good hand hygiene. Clean hands save lives. Hand washing is one of the most important ways to stop the spread of germs, and it's important to wash your hands thoroughly. Did you know there are 5 moments that describe when you should wash your hands at work? These are 1. Before touching a resident. 2. Before a procedure such as putting in eye drops or emptying a urine bag. 3. After a procedure or when you have touched body fluids. 4. After touching the resident or doing cares for the resident. And 5. After touching the surroundings of the resident or items in a resident's room. To wash your hands, wet your hands with running water and apply liquid soap. It's important not to use bars of soap as they can be contaminated with germs and viruses. Rub your hands together for at least 20 seconds. This is the time taken to sing the happy birthday song 1 to 2 times. Make sure all surfaces of your hands are covered with soap, including your palms, the sides of your hands, the backs of your hands, and between your fingers. Rinse your hands, then pat dry with a paper towel. Dry your hands well because damp hands can spread viruses more easily. Use the paper towel to turn off the tap. You should use a suitable hand moisturiser to keep your hands free from cracks and prevent excessive drying. These cracks can allow germs to enter your body and cause infection. Speak with your supervisor if your skin develops cracks or breaks open. To prevent germs and viruses from spreading and to be able to perform good hand hygiene, it's important to keep your nails short. Remove nail polish and artificial nails. Remove jewellery such as rings, watches and bracelets. And keep arms bare below the elbows. Alcohol-based hand rubs are not as effective against germs such as norovirus, but can be used if hand-washing facilities are not available. It's important on leaving the residence room that you go directly to a basin to perform hand hygiene using liquid soap and water before you move on to your next task. Infection control procedures. We mentioned it was important to follow appropriate infection control precautions to prevent the spread of germs and viruses. This includes the use of standard precautions at all times when looking after residents. Standard precautions include using correct hand hygiene methods, wearing personal protective equipment, also known as PPE when required, isolating sick residents, cleaning shared equipment between use, disposing dirty laundry, waste and sharps appropriately, and finally, cleaning the environment correctly. In addition to standard precautions, when looking after residents with gastro, you will need to use what is referred to as contact precautions. This means you must wear a gown or plastic apron, gloves and surgical mask. The correct steps for putting on PPE include: 1. Wash your hands before entering the resident's room. 2. Put on a disposable gown or plastic apron. 3. Apply a surgical mask. Shape over your nose. Tie the top tie first, followed by the bottom tie. This gives a more secure fit. 4. Use protective eyewear if the resident you are looking after is actively vomiting or cleaning up vomit. The eyewear should go over your glasses if you wear them. 5. Put your gloves on last. If wearing a long-sleeve gown, make sure the gloves go over the cuffs of the gown. Contact precautions for sick residents will remain in place during an outbreak. To protect your clothing, you must wear a plastic apron or gown. Long-sleeve gowns are recommended for situations where there is a risk of your clothing becoming contaminated with body fluids such as vomitus or diarrhoea. Gloves are to be worn while in the resident's room. If you are near a resident who is actively vomiting or you are cleaning up vomit or diarrhoea, you should also wear a mask. If you think you are at risk of getting vomit or diarrhoea splashed on your face, you should wear protective eyewear. When you care for your ill resident, your PPE will become contaminated with germs. Do not touch the outside of your eyewear, the front of your apron, or front of your mask. Do not leave the resident's room wearing your PPE. Ensure that hand hygiene equipment is available. Do not use the basin in the resident's ensuite bathroom as it may be contaminated with germs. When removing PPE, 1. Take off your gloves first. Dispose of your gloves and perform hand hygiene. 2. Remove eyewear. 3. Remove your apron or gown and dispose into the waste bin. 4. Perform hand hygiene. 5. Remove and dispose of your mask into the waste bin. 6. Perform hand hygiene and wash your hands with soap and water immediately after leaving the resident's room. Remember, most PPE items are single-use only. Use them once, then throw them away and wash your hands. Do not wear the same PPE to look after more than one resident. Do not hang masks around your neck, put them in your pocket, or lift the mask to talk to someone. It's important you wash your hands before you put on and after you take off gloves. This is because gloves are porous or leaky, and it's easy to get germs on your hands when taking off your gloves. Gloves cannot take the place of washing your hands. If you use gloves, you still need to wash your hands. 5. How do I know the facility has an outbreak? A facility has a gastro outbreak when they have 2 or more cases of gastro in a 24-hour period. This shows that the germ is spreading through the facility. Your manager will contact the local public health unit to notify of the outbreak. The public health unit will provide advice to your manager by telephone and will also provide written resources and letters. Sometimes they may even come to the facility to discuss the outbreak and provide advice on ways to manage the outbreak. 6. Specimen collection. Once cases of gastro are identified, your manager will contact the health practitioner associated with your facility. This may include the GP, nurse practitioner, or the infection prevention and control practitioner. Stool or vomit samples will need to be collected to find out which germ is causing the gastro. Before specimens are collected, hand hygiene must be performed and appropriate PPE must be applied. When finished, dispose of PPE appropriately and wash your hands. Once a gastro outbreak is confirmed, your manager will try to stop the spread of the illness by changing the way you work. This will occur before any results are available from the stool samples. Communication is very important in a gastro outbreak. All staff, residents and visitors should be told of the outbreak. Signs will be displayed across the facility to both inform and remind all people of the outbreak. Staff will be asked to increase hand hygiene practices. 7. Cohorting of residents and staff. In an outbreak, cohorting of residents and staff reduces the spread of infection. So, what is cohorting? Sick residents may be separated from well residents. This is called cohorting of residents. Staff caring for sick residents should not look after well residents. This is called cohorting of staff. To prevent infection from spreading, staff working in affected areas should not work in or visit other areas such as cafeterias, lounges or dining rooms to prevent further spread of infection. Sick residents will be asked to stay in their rooms until 48 hours after their gastro symptoms have stopped to prevent them from spreading germs to others. Residents should have dedicated equipment during an outbreak if possible. If items need to be shared between residents, these should be washed and cleaned well after each use. All group activities and excursions will be stopped until the outbreak is over. Dining rooms and lounge areas will be closed to help stop further spread of gastro. Signs will be displayed to remind all people of the outbreak. Staff should not share food during an outbreak. Staff should change their uniforms daily and launder them between shifts. If a sick resident has a visitor, they should follow facility instructions to prevent further spread of gastro germs. Visitors should not visit if unwell. Your facility manager will communicate with staff and families about visiting policies during an outbreak. Cleaning. During an outbreak, your facility will be cleaned more frequently. A neutral detergent mixed with warm water should be used, followed by a disinfectant solution. Surfaces that are touched a lot should be cleaned twice a day. 8. What should I do if a resident needs to go to hospital? When requesting an ambulance, it's important to let them know the resident has gastro, as this prepares the ambulance and the hospital for correct infection control procedures. 9. What do I do if I start to feel unwell? If you become unwell with gastro, it's important you do not work and that you let your manager know. You will need to stay away from work until 48 hours after your symptoms have completely stopped. Did you know that you can spread the germs during this time, even though you may feel better? 10. How do I know when the outbreak is over? Outbreak measures will remain in place for 72 hours after the last resident at your facility last had gastro symptoms. Your manager and public health will let you know when the outbreak is over. If you have any questions about gastro and would like further information, talk to your manager who can contact your local public health unit. Remember, you have an important role to play in stopping the spread of gastro in your facility.